Welcome back to my YouTube channel. Today we are going to discuss an important topic, anemia. What is anemia? Clinically, anemia is a condition characterized by reduction in hemoglobin concentration along with decrease in packed cell volume and reduced red blood cell count. As a result, the body tissue receives less oxygen, which can lead to symptoms like fatigue, weakness, shortness of breath, and dizziness. Now let's move on to the classification of anemia. Anemia can be classified in two ways: morphological classification and etiological classification. First, let's discuss the morphological classification. Morphological classification is based on the size and the hemoglobin content of the red blood cells. It includes three main types: microcytic hyperchromic anemia, normocytic normochromic anemia, and macrocytic anemia. We will discuss each of this type in detail the following section. First, let's discuss the microcytic hyperchromic anemia. In microcytic hyperchromic anemia, the RBC are smaller than normal and paler in color due to decreased hemoglobin content. In laboratory findings typically shows a decrease in MCV, that means mean corpuscular volume, and decrease in MCH, that means mean corpuscular hemoglobin, and MCH, that means mean corpuscular hemoglobin concentration. Most common example of microcytic hyperchromic anemia include iron deficiency anemia, sideroblastic anemia, and thalassemia. Now let's move on to the normocytic normochromic anemia. In normocytic normochromic anemia, the RBC size are normal and have normal hemoglobin concentration, so they appear normal in color. However, the overall hemoglobin level is low because the total number of RBC is decreased. Laboratory findings show that MCV is normal, MCH is normal, and MCHC is normal. Common example of normocytic normochromic anemia include hemorrhagic anemia, hemolytic anemia, and aplastic anemia. Now let's discuss macrocytic anemia. In macrocytic anemia, the RBC cells are larger than normal in size, usually due to impaired DNA synthesis. Laboratory findings typically shows an increased MCV. Common example of macrocytic anemia is megaloblastic anemia, which is commonly caused by vitamin B12 deficiency or folate deficiency. This is a complete overview of morphological classification of anemia. Now coming to the etiological classification of anemia. Etiological classification of anemia is based on the cause of anemia. First, let's discuss hemorrhagic anemia. This type of anemia occurs due to excessive blood loss. This blood loss is further classified into acute hemorrhage and chronic hemorrhage. Acute hemorrhage is a sudden loss of blood that occurs as a result of trauma, injury, or surgical procedure. Chronic hemorrhage is a slow, continuous loss of blood over the long period of time. This commonly occurs in conditions such as heavy menstrual bleeding, gastrointestinal disease like a peptic ulcer, inflammatory bowel disease. Now coming to the next classification is hemolytic anemia. It is mainly occurs as a result of destruction of RBC. It again classified into two types: extrinsic hemolytic anemia and intrinsic hemolytic anemia. Now coming to the extrinsic hemolytic anemia. In this type, the red blood cells are normal, but they are destroyed by external factors. The cause include liver failure, renal disorder, burns, infections, drugs, and autoimmune disease. So far we discussed extrinsic hemolytic anemia. Now let's move on to the intrinsic hemolytic anemia. In intrinsic hemolytic anemia, it occurs due to genetic defects. Examples include sickle cell anemia, thalassemia. The next classification is nutritional deficiency anemia. It develops when the body does not get enough essential nutrients needed to produce healthy red blood cells. These nutrients include iron, protein, vitamin B12, and folic acid. The next two classifications are anemia due to bone marrow disorders such as aplastic anemia, anemia due to bone marrow infiltration. It occurs when the malignant cells infiltrate the bone marrow, replacing the normal hemopoietic tissue and reducing normal production of RBC. The example includes leukemia, lymphoma, and multiple myeloma. This is a first part of our video on anemia, where we discuss the main classification of anemia. In next part, we will discuss each type in more detail. Thank you for watching. Please subscribe my YouTube channel.